Adenomyosis is a common gynecological problem and it is a challenging condition to treat. It causes a lot of suffering to the woman. It causes severe pelvic cramp and heavy menstrual bleeding. The pelvic cramps can be so severe that it affects the daily routine and work. Because of the severe pelvic cramp, patient would avoid going to the social gathering and would avoid traveling. Gynecologists often recommend hysterectomy as a permanent solution. For those patients who do not want surgery, they offer hormonal therapy including oral contraceptive pills and Mirena insertion. Hormonal therapy has its own limitations, especially it causes postmenopausal symptoms including hot flushes, mood swing, irritability, depression, and sometimes it causes intermittent bleeding. Many patients, they don't tolerate Mirena insertion, and we should not use hormonal therapy for long term, especially it can cause bone weakening. If you are diagnosed with adenomyosis and you are suffering with severe pelvic cramps and heavy menstrual bleeding, you have tried all available options, you have tried hormonal therapy, Mirena insertion, but failed, and only option you heard from gynecologist is hysterectomy, then you need not worry, because now we have most recent advanced endovascular technique to treat this kind of problem, and that technique is known as uterine artery embolization. Uterine artery embolization is a non-surgical technique. It is alternative to hysterectomy. It will preserve the uterus and preserve your fertility. In this technique, we make a small nick at the groin artery and we pass a thin plastic catheter selectively to the uterine artery. Once we are very distally in the uterine artery, we block the blood supply of adenomyosis using microparticles. This is the microcatheter which we use in these cases. This microcatheter, they navigate very distally into the uterine artery without hurting the uterine artery, and these are the microparticles which we use. These microparticles are color coded depending upon the size of the particles. So this color, for example, this is the smallest size 100 to 300 micron, and this is the largest, about 700 to 900 micron. For adenomyosis tissue, we use the smaller sizes because these smaller microparticles will go selectively into the circulation of adenomyosis tissue. Once the blood supply of adenomyosis tissue is blocked, it will get infarcted, it will die, and it will shrink to the smaller size. On an average, we expect that this bulky uterus will shrink to the smaller size, approximately 1/3 to 1/2 of its original size in 3 to 6 month time. This procedure will take less than 1 hour and is done under local anesthesia. You will be discharged on the same day or very next day. You could resume your daily activities after 48 hours and you could resume your work within 1 week. The recovery time is short and hospital stay is short. Uterine artery embolization for adenomyosis has very good short-term and long-term outcome. More than 80% women, they report significant improvement in their quality of life and resolution of their symptoms. So please do not get disappointed if you are suffering with adenomyosis and you hear only about hysterectomy as a treatment option. Now we have uterine artery embolization as a non-surgical treatment option with very good outcome.